Good day. I wanted to talk today about strokes. Why the MRI versus CT may not be the best choice right away. So, first, I just want to talk about what is a stroke. We have to separate what that is first. So, basically, a stroke is a blockage of blood flow to the brain. This can be disturbed either by a clot or it could just be bleeding out in that area because the vessel that supplies the blood to that part of the brain burst open for whatever reason, usually high blood pressure, because the tension over time weakens the wall to allow a disruption of blood flow. So there we go. Now, the best way I can explain this is let's go back to situations where you may have like some friends over and you played a game called charades. So I'm going to kind of tell on myself because I like to draw. And because I like to draw, sometimes I overdo it. For example, I remember I was playing charade with some friends and my word was a cross, right? Actually, it was a church. It was a church. So it was a church. So what I did was I drew the building and I was actually competing against someone. So I drew the building, and when I drew the building at the top, I knew for sure I was gonna win this. I drew the top of the church to have a cross. And I can see the next person next to me, my competitor, they saw that I drew the house. They saw, I was like, oh, okay, like was copying off of me at this point, right? But what I did was I drew like this 4D type cross with shading, and it's like my team was like so lost. They were just trying to figure it out. They just had all kind of things. There was like a star at the top of the house, a lighthouse, and this. So I really confused them, and I should have just gotten to the point, right? The person next to me, after they drew the building, all they did was like this. They just drew across the letter T, the little letter T, and I just was like, dang, that was too complicated. So I'm bringing you into what this means. So that's basically what the CT does. It just gets to the point. The MRI is more detailed. It's a wonderful tool once things sorted out. Once we figure out what's going on. But the CT gets to the point. It's the gold standard. It's a quicker to do versus an MRI. You lay there, you get prepared. It sometimes I've seen 3 hours worth of MRIs done as an ICU nurse, but usually that's like overall different body parts and everything. But when it comes to the CT versus the MRI, they're both only checking for the brain. The reason why is when you come in, one of the most important things we need to know was when was the last time you were well. This determines if you're a candidate for a medication, abbreviated TPA, but basically it's a clot buster. So it breaks up clots. We need to know this right away to treat you as soon as possible. So we don't need to waste time with having some long-term MRI going on. You already are wasting time in that respect. The literature states we like to give it in a 3-hour window from the time you first suspect it's a stroke, in which your symptoms start to show up. And imagine like wasting a whole hour in an MRI machine versus 10 minutes CT, CAT scan of your brain, right? So when it comes to that medication, you don't want to give it, the other side of it, you don't want to give it if you're having a bleeding stroke, because what it's doing is keeping your blood from clotting, and it's also breaking up any clots that's there. And we don't want that with a bleeding stroke because you're going to make it worse. Actually, one of the risks of having this medication, this clot buster, even if you do have a clot there, is that it can transition into a bleeding stroke. And this is the reason why they'll keep you longer inside the hospital just to monitor for that, as well as perform other tests. So there's a lot of different layers to helping you out with a stroke, but when you first come in, time is brain. That's what they say. Time is brain. People know the saying time is money, but when it comes to strokes, time is brain. So you don't want to waste time doing a long scan like MRI versus a CT. And this is why it's considered a gold standard. I hope you learned something from this video. Like and subscribe if you learned something. I plan to do more videos just to simplify things you may experience seen in the hospital. I live in South Florida. We have a lot of elderly patients here. So I don't want to say it's common, but it's just good to know these things when you go into the hospital. See you soon on the next video. Thank you for watching.